Understand what ANCA antibodies are. ANCA stands for anti, which means against, neutrophil, which is a type of white blood cell, cytoplasmic, which means the inside of the neutrophil, autoantibodies, which means these antibodies are attacking the self, so they would be attacking the patient. Normal antibodies are molecules that are produced in the circulation as defense against, for example, bacteria, and they attack the bacteria and protect us. But in autoimmune diseases, the antibodies attack some cell or tissue in the body. So ANCA disease is a form of autoimmune disease, and these ANCA antibodies are attacking white blood cells. So what is vasculitis? So vasculitis is when white blood cells are actually attacking the vessels. Vasculitis means inflammation of vessels. I'm sure you've heard lots of terms that have itis at the end of them. For example, sinusitis is inflammation of the sinuses in the nose. Arthritis is inflammation of the joints. Vasculitis is inflammation of the vessels. And inflammation is when white blood cells that normally are protecting us attack some part of the body. So ANCA vasculitis is when white blood cells attack vessels as a result of these ANCA autoantibodies stimulating the white blood cells. So that's what ANCA vasculitis is. Let's think about how this happens in the body. And so here's a diagram of a vessel in the body. And what you see in the center of the cross-section of this vessel is a representation of the blood. So there's a red structure there that stands for a red blood cell, and there's a green structure there that represents a white blood cell, the kind of white blood cell that ANCA antibodies attacks, called a neutrophil. And then the yellow cell is the lining of the blood vessel. It's also called an endothelial cell. At the lower part of the diagram, you see sort of a section through the vessel lengthwise. And you can imagine that those cells are flowing through the inside of that vessel in the blood, the red blood cells and the different white blood cells. So that's normal. That's what's happening in your blood vessels right now as you're listening to this.
But we're talking mostly about white blood cells with ANCA vasculitis.
That's right, Diane. So the red blood cells are not attacked by these antibodies. They recognize molecules that are specifically on certain types of white blood cells, especially neutrophils. Okay. So they're the ones being attacked. And so you see in this diagram, the little Y-shaped structures represent the antibodies. And the little red triangles represent this molecule that I mentioned that these antibodies attach to and recognize, so to speak, on the surface of the white blood cells, the neutrophils here. And when these antibodies attach to those white blood cells, they stimulate them and they cause them to stick to the walls of the blood vessels and actually release a lot of factors that in attack of a bacterial infection would be useful because they'd be destroying the bacteria. But in this autoimmune disease, they're detrimental because they attack the vessel wall and tear it apart. And that results in the disease that occurs in patients. So in this next slide, you can see an actual a photomicrograph. So this is a photograph taken through a microscope that shows on the right-hand side, inside the red circle, a spot of injury to a small vessel. This is a vessel called a small artery. On the left-hand side, you can see a representation of what this small vessel should look like normally. You can see a few red blood cells in the inside of the vessel, and the vessel wall is a little distinct from the tissue around it. In the panel on the right, you see an actual photograph of the severe destruction in part of the wall of that vessel caused by this process we've been talking about. So in this patient, the ANCA antibodies bound to the neutrophils and cause them to stick on the wall of this vessel and chew a hole through the vessel.
And that red area towards the bottom, that's where it's chewed through the cell wall?
Yes, exactly. So that red material is actually, in essence, a blood clot. And so the blood has clotted there, trying to wall off the hole in the vessel so the bleeding won't continue too severely. But so that red area is an area of severe destruction. So that's in the wall of a vessel from a biopsy specimen from a patient with ANCA vasculitis. This next slide just shows another example of a very small vessel that's been attacked by ANCA vasculitis. Both panels are the same photograph of the microscopic appearance of this vessel. In the panel above, I've drawn an outline around where the wall of the vessel should be. The top part of the vessel has not been attacked to any significant degree, but the bottom part you can see, especially in the drawing, or rather the circle drawn in the panel at the bottom, there are a lot of little dark structures that actually are white blood cells. With this particular stain, they appear dark in this tissue section. But you can see there are a lot of these little white blood cells swarming around the wall of the vessel there and releasing factors that are destroying the wall at this site of vasculitis. So that kind of injury, Diane, can occur in any tissue of the body. So the clinical manifestations of ANCA disease are extremely varied. It depends on where the vessels are that are being attacked by these white blood cells. For example, if they're in the skin, the little vessels can be torn open and there can be small hemorrhages, and you'll have little purple spots on your skin called purpura as a manifestation of the vasculitis.
Kind of like a bruise, like a little teeny bruise?
Yeah, a little tiny, like a little tiny bruise. With a bruise, the blood vessels are broken open by trauma. You just mash the vessel and it bleeds. Here the vessels are broken open because the white blood cells have chewed holes through them. The same thing can happen in the lungs, and the small blood vessels lining the air spaces in the lung can be broken open by the vasculitis, and you'll bleed into your lung and you may cough up the blood. It can happen in your sinuses, in your nose, and cause destruction of tissue in your nose, and you can have bleeding from your nose. Little vessels in the nerves throughout your body can be involved with vasculitis, and so your nerves will send strange signals, and you'll feel like you have a tingling sensation in your hands or in your feet, or you'll be weak in your legs because the nerves aren't working correctly. And as we'll talk about in more detail later, there are many small vessels in the kidneys that are involved in filtering the blood, and they are a frequent target for attack by ANCA disease. So we'll talk about that shortly.
And also about the eyes. Can it also be in your eyes?
Right. So ANCA disease, again, can attack any tissue, including your brain and your eyes and your ears. And so in the eyes, there may be inflammation in the tissues around your eyes, and it's really the small vessels. And so your eyes can become very red. There may be even very swollen areas caused by the inflammation. So this next slide shows a photograph of the lower leg. So there's a little bit of the foot at the bottom of the picture, and then the ankle and the lower part of the leg. And you can see that there are little red spots all over the leg. And at each of these little spots, there's been inflammatory injury to the vessels, resulting in some hemorrhage.
Now, is it always this pronounced, or is it sometimes more subtle?
It can be subtle. Another feature is that these spots sometimes come and go. So there'll be episodes of vasculitis in your lower extremities with purpura, and then they'll fade away, and then they may come back again. But the lower extremity and the buttocks are frequent sites where you can see this pattern of vasculitis, although they can occur in other locations as well. So I mentioned that ANCA vasculitis often attacks the kidney. The kidneys are very complex structures, and most people really aren't very familiar with the structure of the kidney. So let me take a minute explaining what is actually under attack in the kidneys and what causes so-called glomerulonephritis, which many patients who have ANCA disease will hear is one of the manifestations of their disease. And this may be detected because when there's attack on these structures, you spill blood and protein into your urine, and so you may be told that you have hematuria, blood in the urine, or proteinuria, protein in the urine, and the kidneys may stop functioning if the injury is severe enough.
Tell me about protein in the urine. I understand blood, but the protein, what's...
Protein is a very substantial component of the blood in addition to the cells. So in your circulating blood, of course, you have the red blood cells, but you also have the fluid called the plasma that the red blood cells are floating in. And the plasma is comprised of water and electrolytes and a lot of proteins. And so the protein that's in this fluid usually doesn't spill out in the kidney. The kidney filters out tiny little waste material that's smaller than the proteins and retains the proteins normally, just like it retains the red blood cells. But when you injure the capillary walls, not only the red blood cells, but the protein spills out into the urine.
Okay.
So let's look at a diagram here that's a cross-section of a kidney. Of course, you have two kidneys in the back wall of the abdomen. Here we see one kidney that's been diagrammatically cut open, and there's an arrow to something called a nephron. The nephron is the real functional unit of the kidney, and it's an important part. That's why the doctor that's taking care of you may be called a nephrologist, because he studies disease of the nephron. So you can see on the right-hand side a diagram of just one nephron. There are about 1 million of these in each kidney, so they're very tiny. And the working part of the nephron includes both a little cluster of blood vessels called a glomerulus, and the little cluster of blood vessels has blood coming in which is unfiltered, and then that blood gets filtered in these glomeruli, and the filtered blood goes out to your body with the waste material removed. And what's been removed from the blood then goes down the tubule, and you can see a little contorted tubule that twists and turns down through the kidney, and then the fluid exits that tubule as the urine. So that's the little structure that functions in the kidney, and this is attacked in ANCA disease. And specifically, the part that's attacked are the tiny little vessels in a glomerulus. And so in this panel, you can see on the right-hand side a very large electron micrograph in 3 dimensions of what a glomerulus looks like. And you can see the vessel coming in on the right-hand side, and then there's this little tangle of tiny little vessels, and then a vessel leaving. When we look at this in a biopsy specimen, we take a thin cross-section and stain it with dyes so that we can see the various parts of that glomerulus. And here you see a normal one that's been cut in cross-section from a biopsy. And you can see little tiny round holes. These are cross-sections of the tiny little capillaries. And on the far left, there's a drawing that depicts the cross-section of these little capillaries. So can you see that reasonably well, Diane?
Yes.
So back to your question about proteinuria. So here's a diagram. So if we just go back to that previous picture for a minute and we look at just one of those capillaries that the arrow is pointing to on the left and blow it up even bigger in this diagram, now you can see it has the structure like a little vessel that we talked about before, and on the left is what it looks like normally with the red blood cells and a white blood cell, and the little tiny golden globes represent proteins. And normally those will be contained within that capillary, and the only thing that will ooze across the capillary wall into the urine will be water and very tiny molecules in the water. And your kidney will retain the proteins and the red blood cells for the usual purposes your body uses them for. But when you have damage to the glomerular capillaries, shown on the right, you spill red blood cells into the urine and you spill protein into the urine. And that's what is detected in the laboratory and referred to as proteinuria, protein in the urine, and hematuria. So there's been injury.
So this is why when you go to see your doctor for checkups, you tend to have a urine sample so that he or she can look for this type of evidence.
Exactly. So in this slide, there's again a diagram and then some actual photographs of what's seen through the microscope in a patient with ANCA vasculitis. When ANCA vasculitis affects the glomerulus in the nephron, it's called glomerulonephritis, inflammation of the glomerular part of the nephron. So on the left, again, is just a representation of what the glomerulus should look like normally, with all the little capillaries intact. And on the right, you can see damage to the glomerulus diagrammed above, which shows this increase in a number of cells, and there's some little smudgy red material in there. And then on the panel below, the actual photograph of the microscopy, and that red material is the same material, Diane, that you were asking about in the vessel earlier.
Right.
So it's the same sort of process that we saw in other vessels and other tissues, but in this instance it's affecting these little capillaries in the glomerulus. So that red material is clotting, in essence, of the blood, trying to prevent this bleeding into the urinary space, and there's a reaction of other cells around it, which is all the material diagrammed in green above.
So you have the bleeding, which you had mentioned earlier, but you also were talking about clotting. Is there a danger with clotting as the disease is coming on, as there would be with bleeding as in a hemorrhage?
Well, there are some patients with ANCA disease who do have problems with too much clotting, and that's a subject really for another discussion. In this setting, it's hard to know how the clotting is affecting the disease process, whether it's actually beneficial to the patient by helping plug up some of these injured capillaries, or it's actually contributing to the renal failure by blocking the flow of blood in part. So it's really not clear how important it is in injury or repair. But you're absolutely right. In some patients, there actually are problems with clotting in bigger vessels at other sites that your nephrologist or other clinician needs to identify if it's occurring. This next slide shows a higher magnification photograph of the injured glomerulus on the right, just to mention something that you and other patients may hear described by your nephrologist, and this is something called a crescent. And so sometimes you hear your glomerulonephritis in ANCA disease referred to as a crescentic glomerulonephritis, which means it has lots of crescents. It's just an indication that there is this accumulation of cells that's seen by the pathologist in the biopsy that's shaped like a crescent, which is diagram there with the red line. And it indicates that there's active inflammatory injury to the glomerular capillaries. Now, there's another term that patients with ANCA disease may hear, especially if they have the type of ANCA vasculitis that you have, Diane, called Wegener's granulomatosis. So what's a granuloma? What's granulomatosis? So a granuloma is just a particular form of inflammation that results in a mass of inflammatory tissue that produces a nodule in various sites within your body. Wegener's granulomatosis is the form of ANCA disease that has a lot of this granulomatous inflammation, and it can occur at any site, but it often occurs in the upper respiratory tract, for example, in the nose, in the eyes, in the major airways, and it also frequently affects the lungs. For example, patients with Wegener's granulomatosis, if they have a chest x-ray, may have nodules in their lungs, which are the result of these nodules of granulomatous inflammation. So it's a particular type of inflammation that occurs in certain forms of ANCA vasculitis, including Wegener's granulomatosis. And so in this photograph, you can see a segment of lung that was taken out surgically from a patient with Wegener's granulomatosis, and the yellow nodule and the upper part of this specimen is an area of granulomatous inflammation. You can compare that to the more normal lung tissue at the bottom part of the picture.
Would this be something that would be done when a patient was suspected of having vasculitis, or at what point would such a surgery or a biopsy take place?
Well, in some instances, the diagnosis of an ANCA vasculitis is not absolutely clear from the clinical manifestations. And some patients will not have an ANCA antibody that's detectable in the circulation, or it may not have been looked for yet. And so by X-ray, these mass lesions are difficult to diagnose, so it's not absolutely clear what they might be. So in some circumstances, these nodules are taken out surgically as a diagnostic procedure to confirm what it is, because by X-ray, they can sometimes, for example, even look like a cancer of some sort. But then when you examine them by microscopy, they're inflammatory lesions. So sometimes it's a diagnostic procedure. So what are these different types of ANCA vasculitis? Diane, you've mentioned that your type of ANCA vasculitis is called Wegener's granulomatosis, so I've already mentioned some characteristics of that, but let's think about these other variants. And the different types really are determined by where the vasculitis is in your body and whether it's associated with the granulomatous inflammation we just talked about, and whether or not you have also a history of asthma, because there's a form of ANCA vasculitis that is accompanied by asthma. So the easiest one to describe is the one that has the least well-defined name, and it's when you have ANCA vasculitis that's only affecting your kidney. And some people, especially in Europe, refer to this as renal-limited vasculitis, which is pretty self-explanatory. In the U.S., in particular, oftentimes it's called ANCA glomerulonephritis. But in any event, in some patients, at least at the time of diagnosis, the disease is confined to the kidney as far as one can determine. Now, over time, that might change. So you might initially have just proteinuria and hematuria and a little bit of renal insufficiency, and a kidney biopsy shows a ANCA-type vasculitis. But then later on, you might develop some purpura and some pulmonary lung hemorrhage, and you would then be said to have microscopic polyangiitis, because the other Another category of ANCA disease involves multiple small vessels, but there's no evidence for granulomatous inflammation. So you'd have maybe kidney involvement, skin involvement, lung involvement, maybe nerve involvement with vasculitis, but no nodules anywhere, no evidence for granulomatous inflammation. So when there are multiple sites involved, it's called microscopic polyangiitis.
And polyangiitis means multiple.
Well, exactly, right. Poly means many. So, and angiitis means inflammation of vessels, because A-N-G, actually is a term that refers to vessels. So polyangiitis means that there's inflammation of a lot of, in fact, different types of vessels in different locations. And microscopic just emphasizes that ANCA disease tends to attack small vessels rather than bigger vessels. So, as I mentioned earlier, if you have this vasculitis in small vessels and you also have evidence for granulomatous inflammation but no asthma, then Wegener's granulomatosis is the diagnosis. So if you had nodules in your lung due to granulomatous inflammation, or you had destructive disease in your sinuses that was destroying bone, and histologically the pathologist saw granulomas attacking the nose tissue, then the diagnosis would be Wegener's granulomatosis. And for some reason, this very often affects the lungs and the upper respiratory tract, the nose, the sinuses, the eyes, and also even the ears in some patients. And then finally, the least common form of ANCA vasculitis is called Churg-Strauss syndrome, and it's the presence of the manifestations we've been talking about accompanied by asthma. So to summarize then, Diane, ANCA antibodies are a type of autoantibody that attacks your own white blood cells, causes them to attack the vessels in many different tissues, which results in the disease that you're experiencing. And a very special